In order to make comparisons between working age and older persons based on need, we must have a tool that measures need the same way across age groups. In other words, we shouldn't have different rulers for the elderly and different rulers for the working age group, and as well, different rulers for children. I'll just say, because this gets rather complex and we could have a State of the Science conference on measurement, I'm sure, that the notion of the ruler is based on what we call latent variable measurement theory. And although the ADLs are used routinely to make judgments about whether working age people should get PAS or elderly people should get PAS, researchers have begun to look at this, and the ADLs, in fact, don't work that well across age groups. So, for example, using data from the National Health Interview Survey, Spector, Fleischman, and Altman, colleagues at AHRQ, found significant differences in the scalability, or how the ruler works, of the IADLs by age and gender. And they weren't able to resolve that. They said, well, you're going to have to adjust for these differences by age. And I've just completed a study using the same data, but the second phase of it, and also found significant age-related differential item functioning, that the ruler doesn't work so well for working age and older people. But there are 6 items that I found that are comparable by age. So these items are grocery shopping, dressing, managing medications, going to the toilet and using the toilet, using the phone, and eating. And what I'm showing here is the hours of help per week that people receive, depending on how many of these IADLs the person has, which increases from about 15 hours for those with none of these, which means that they have some other kind of ADL, to around 120 hours for people who have all 6 items, need help in all 6 items. The elderly are a little bit higher in terms of hours in the moderate range of disability, but for the statisticians in the crowd, you can see that the error bars are overlapping there, so it's not really that significant a difference. So, in fact, when we do have a ruler that works the same way for working age and older people, we get a similar result in terms of the hours of help that people need. Okay, so based on the work that we've done on hours of PAS, we estimate that there are 22 billion hours of PAS provided per year, which has an economic value of more than $200 billion. That includes valuing the unpaid help that people get from their family and friends. Now, the big thing here is that most of this is just unpaid help. Looking at hours of help that people get, 85% of the hours are unpaid. So the paid PAS is only 15% of the pie here. And we all know that most of the unpaid caregivers, almost 70%, are women who provide more care and experience greater stress than male caregivers. You can see this report from National Alliance on Caregiving and AARP, which has done great work in this area. Now, looking at unmet need, the literature says there's a range of from 20 to 33% of the older population that needs help with daily activities that has unmet need. Various studies by Ken Manton, USGAO, Dr. Desai from NCHS. We found, and these papers are available over there, that around 20% of people 18 and older who need help say that they have either that they're not getting help or they need more help than they're getting. Now, I would venture that many people would think that the older population has the greatest unmet need, but we actually see that people in their 40s and 50s do. Among those who need help from another person at ages 40 to 64, almost 40% have unmet need compared to 20% at ages 80 and over. We're exploring the reasons for this in ongoing analyses looking at family structure and competing demands on caregivers, as well as lower access to personal assistance, paid personal assistance for this age group. What we wanted to see with this data, how far off, if people need more help than they're getting, how far off are the hours of help that people are getting from what they might need. So we did an analysis of this, and we found the shortfall is about 17 hours of help per week. That shortfall exists for people with 2 or more ADLs, but there wasn't any significant difference in the hours for people who had a lower disability level. So, that gives us some idea then of, what it might cost to address this problem, since most of the cost is going to be in terms of providing the hours of help that people need. Furthermore, in order to sort of nail this down further, this concept of unmet need and how valid it is, we looked at 53 measures of potential adverse consequences that are associated with unmet need. These are things like falling down and injuring yourself, losing weight unintentionally, dissatisfaction, discomfort, etc. And those who have unmet needs were much more likely to experience adverse consequences on 48 out of 53 of the measures tested. And just to give you a flavor of what these are. People with unmet needs are 4 times as likely to be unable to eat what they want, to follow a special diet if they have to run out of food, to go hungry, to be unable to go places, including visiting a doctor or, just getting about in the community. They're 3 times as likely to feel discomfort in most activities and to be dissatisfied. Twice as likely to lose weight unintentionally, that's my dad, 86 years old, to be dehydrated, to soil their clothing, and 150% more likely to fall, be injured from falling, have bed sores, or chronic stiffness in limbs. Now, people who live alone are at greater risk. They have a greater shortfall in hours relatively than those living with others. About 44% of the hours people need are unmet among people who live alone. And they have higher rates of adverse consequences than people who live with others and have unmet needs on 38 of the 53 measures tested. So again, compared to other people with unmet needs who live with others, those who live alone are 5 times as likely to have gone hungry in the past month and to have lost weight unintentionally.